Hello and welcome to the Healthy Care YouTube channel. In today's video, we'll dive into Down syndrome, a genetic condition that impacts millions worldwide. This comprehensive guide will walk you through its causes, symptoms, diagnosis, and the kinds of treatments available to help people with Down syndrome live fulfilling lives. Part 1. What is Down syndrome? Down syndrome is a genetic disorder that causes mild to significant physical and developmental challenges. People with Down syndrome are born with an extra chromosome, which is a bundle of genes that makes up part of our genetic makeup. Typically, a person has 23 pairs of chromosomes, but in cases of Down syndrome, there's an extra copy of chromosome 21. This extra chromosome leads to various mental and physical characteristics. Down syndrome is named after Dr. John Langdon Down, who first described the condition in the 1860s. Although it cannot be cured, medical research and early intervention techniques have significantly improved the quality of life for individuals with Down syndrome. Part 2. Types of Down syndrome. There are three main types of Down syndrome. Trisomy 21, the most common form, accounting for 95% of all cases. In trisomy 21, every cell in the body has an extra copy of chromosome 21. Translocation Down syndrome. About 3% of individuals with Down syndrome have this form, where chromosome 21 attaches to another chromosome instead of being separate. Mosaic Down syndrome. This rare type affects around 2% of people with Down syndrome. Only some cells have the extra chromosome, leading to milder symptoms. Part 3. Symptoms of Down syndrome. People with Down syndrome share some common physical characteristics and developmental traits. Though each individual is unique, physical traits often include almond-shaped eyes, a flat nasal bridge, and a short neck. Developmental delays are typical, with challenges in cognitive functions like memory and reasoning. Learning and developing new skills can take longer, but with the right support, individuals can achieve significant milestones. People with Down syndrome can have a wide range of abilities. Some may need daily assistance, while others can live independently and even attend specialized educational programs. Part 4. How many people have Down syndrome? While the exact global number of individuals with Down syndrome is unknown, estimates suggest it could be as high as 6 million people. In the U.S. alone, about 1 in 700 babies are born with Down syndrome each year, making it the most common chromosomal condition in America. Part 5. Down syndrome versus autism. Understanding the differences. Many people confuse Down syndrome with autism, but they are distinct conditions. Let's clarify the key differences. Down syndrome is a genetic condition often accompanied by physical traits, and people with Down syndrome are generally social and enjoy interacting with others. Autism is a neurological condition that affects brain function and often leads to challenges with social skills and communication. People with autism might prefer solitary activities and can have delayed language development. Despite these differences, both conditions may include developmental delays, preference for routines, and some challenging behaviors, like difficulty managing frustration. Part 6. What causes Down syndrome? Down syndrome results from an extra copy of chromosome 21, but scientists aren't entirely sure why this occurs. It is not caused by anything the parents did before or during pregnancy. While Down syndrome can sometimes be hereditary, most cases occur randomly during the formation of reproductive cells. Certain factors, like maternal age, can increase the likelihood of having a child with Down syndrome. Women over 35 have a higher risk, and men over 40 may also increase the risk, particularly when the mother is over 35. Part 7. Diagnosing Down syndrome, testing and screening. Testing for Down syndrome is often done during pregnancy. First trimester screening includes a blood test to measure specific hormones and an ultrasound to assess the nuchal translucency in the baby's neck. Cell-free DNA test examines the baby's DNA circulating in the mother's blood. Quad screen test in the second trimester provides additional insights through hormonal analysis. If these screenings indicate a high risk of Down syndrome, diagnostic tests like chorionic villus sampling, CVS, and amniocentesis can confirm the condition by analyzing the baby's genetic material. Part 8. Living with Down syndrome, health and lifestyle. Down syndrome can present various health challenges, heart issues. About half of all babies with Down syndrome are born with heart defects, some of which may require surgery. Hearing and vision problems. Individuals may experience hearing loss, vision difficulties, or other sensory issues. Thyroid and gastrointestinal issues. People with Down syndrome may be more prone to thyroid disorders and digestive issues like celiac disease. Part 9. Therapies and treatments for Down syndrome. Although Down syndrome cannot be cured, several treatments can help improve quality of life. Physical therapy helps improve strength, balance, and motor skills. Speech therapy focuses on enhancing communication skills. Occupational therapy aids in daily tasks, like dressing and eating independently. Behavioral therapy addresses conditions like ADHD or anxiety, which may also be present. Educational services play a critical role in helping children with Down syndrome achieve developmental goals. Individualized education programs, IEPs, ensure they receive the necessary support tailored to their unique needs. Part 10. Support for families and caregivers. Raising a child with Down syndrome can be both rewarding and challenging. Support systems are vital. Parental support groups offer emotional support and share useful tips. Medical and educational resources help caregivers access therapies and educational services. Recreational programs provide a structured way for children to develop social skills and enjoy new activities. Every child with Down syndrome is unique, and with the right care and support, they can lead fulfilling, joyful lives. Connecting with other families, staying informed about advancements in treatment, and fostering a supportive environment can make a significant difference. Down syndrome affects millions worldwide, but thanks to modern medicine and community support, individuals with this condition can achieve meaningful milestones and lead enriched lives. Whether you're a family member, friend, or caregiver, understanding Down syndrome and knowing about available resources is essential. We hope this video helps you gain insight into Down syndrome and how to support those who have it. Thank you for watching. If you found this information helpful, please like, share, and subscribe to our channel for more health-related content.